Dr. Haque, thank you for being with us. So it seems that some kind of review potentially is underway of the easing of restrictions over Christmas. What should the government be doing, do you think?
Well, I think they need to be reassessing their decision. You know, at the moment, we haven't seen to this day the science behind their decision to open up Christmas for 5 days with 3 families, and opening it up in the context of surging coronavirus cases across London, across the southeast, across eastern areas of England, across the northwest. It's increasing almost everywhere, and yet the government have sent this message that it's an open Christmas. Now, they sent it a while ago. We think this is a good opportunity for them to reassess the message, because Christmas should be a time to be with loved ones, but in a way that it is safe and in a way that people can be together safely.
I mean, it's not exactly an open Christmas, is it? Because it is still a restricted one. It's not a normal Christmas for people. It's a bubble of 3 families for a limited period. I mean, you talk about the science there, but I suppose there's a lot more than just science in this decision, isn't there? The government also weighing up the mental health implications of people being isolated over what is a very difficult time.
You're absolutely right. These are not normal times. But at the same time, while we completely recognise at independent stage that, you know, for some people, it will be very difficult. For some people, this will be, sadly, a last Christmas. For others, this has been a very difficult year and had a mental health impact. And we have said that actually those people should get together. They can get together safely. It's better to be outdoors rather than indoors. If you're going to be indoors, you know, make sure that your house is well ventilated, wear masks if you can, social distance and so on. It is possible. But the reality is, Sarah, we are in a context now where coronavirus cases have been surging. We are in a context where over 10 million people in this country are in tier 3 because it is so bad. And we're in that context, of course, because the government has wholeheartedly, completely failed with their test and trace system. We're in this context because they haven't been managing this virus, let alone suppressing this virus. But that means that we need to take care of our loved ones, of our family and friends this Christmas. And while the government is not taking that important decision to protect people, for instance, we've seen with Greenwich Council, they're taking legal action, even though Greenwich Council has said, actually, we need to close schools because secondary school pupils, for instance, have the highest rate of infections. But the government is saying, no, you don't need to self-isolate. You don't need to protect your family. Go ahead and have that open Christmas.
I think it's not about whether protecting your family or not, is it? The government's priority is preserving children's education and the long-term impact on that. What kind of government could... Sorry, Zubaida, carry on.
If that were true, Sarah, then what they should have been doing this whole time, they've had months and months and months to do this, including over summer, is to keep schools safe. The government's mantra with schools is just keep schools open. But keeping schools open means keeping schools safe. And in order to keep schools safe, they needed to have smaller class sizes. They needed to have better ventilation. Schools have had none of that support. Independent Sage said that secondary school pupils should wear masks in classrooms. The government has not mandated that at all. They haven't helped to keep schools safe. So actually, in the absence of that action, in the absence of supporting schools, councils have had to step in.
We have had the announcement today of weekly rapid flow tests for secondary schools from January. Obviously, that doesn't help in this last few days of term before Christmas, but it is a step forwards in terms of keeping schools open, isn't it? In terms of the restrictions over Christmas and what the government could do, I wonder how difficult it is politically for a government to say you cannot see your family members over Christmas, that even to criminalise it, to make it against the law to see family members over Christmas, rather than what we're getting at the moment, and obviously we'll see the outcome of the meetings later today, but what we're getting at the moment is you don't have to do it. Please make your own decisions and please bear in mind the safety of your family members.
Well, actually, when a government gives permission for people to get together, even in a limited way, I think the public have every right to assume that that permission is based on the safety, on their own safety, on a public health message. But as I've mentioned, we haven't seen the science behind that decision. There's no question, really, that the decision for an open Christmas, or if you like, a Christmas amnesty, in the context of nearly 2/3 of this country being in harsher restrictions, was a politically based one. Now, actually, what's really important now is the government still have the opportunity to say, look, we made this decision a few weeks ago, coronavirus cases looked like they were coming under control, but now we've had another surge, so it's about time. We've had another surge. So in order to protect you, which is our job in this pandemic, in order to protect you, in order to keep vulnerable people and elderly people safe, what we need to do is restrict the number of days that we get together. What we need to do is, if we can avoid it, not to get together with 3 families.
So just to be clear, rather than cancelling it altogether, are you suggesting a shortening of that window and fewer households mixing?
Absolutely, and mixing outdoors rather than indoors, and if you mix indoors, then keep it ventilated. The reality is, Sarah, the government have literally just said open Christmas, but not really helps people to make that informed choice, and they need to. It is their responsibility to look after the public. This is not about politics, this is about science, this is about public health, and it is about keeping the public safe.
Dr. Zubaida Haque, thank you.
Thank you.
The leader of Greenwich Council has said